So welcome to Tracey Bell. Today we're going to demonstrate the use of Botox and also dermal fillers. Lynn is 51. She's a regular attender at Tracey Bell and she's kindly volunteered to show us the process of Botox. In Lynn's case, we are going to use Botox in the upper third of the face. Botox is used around the crow's feet, in the glabella and also in the forehead. The procedure should be simple, safe and effective, and for demonstration purposes we'll cleanse first of all the area. We've checked the medical history of the patient, we have assigned consent, and we've advised the patient that the results should be visible in around about 3 to 4 days. Botox works on the dynamic muscles, i.e. those muscles that when we smile or animate appear. Okay, so can we pass please? Okay Lynn, I'd like you to close your eyes for me and I'd like you to frown. Okay, and relax. Thank you very much. So, in the glabella, we place a series of 3 small injections. The total units are 20 units. Okay, Lynn, how does that feel?
Fine.
Okay, beautiful. Okay, next please. Thank you very much. Okay, in the forehead, what I always like to do is I put 2 fingers above the lateral brow, and within those points, I would never inject within those points. I would then, in Lynn's case, I'm going to place 4 units into the frontalis, 4 units, turn this way for me Lynn, 4 units, and again 2 fingers and 4 units. What that will do, that will allow me to have lift but also smoothness. Lynn, I'd like you to just turn your head for me. Crow's feet. Lynn, can we smile, please? This area are the crow's feet. Relax for me. What we do is we feel for the orbital rim. We come 1/2 centimetre out and we inject 4 units. We then place a second injection of 4 units above the medial canthus, and then we aim down towards the nose for these lateral fibres. How do you feel, Lynn?
Fine.
Okay, if you'd like to turn towards me, Lynn. And again, Lynn. Smile. Okay, so we inject, aim down towards the nose, and the total number of units for the crow's feet are 12 units. Okay. Now these little marks that you see will normally disappear within 2 to 3 minutes. All that is the injection of the Botox and the mixture of the saline. I always like to ensure that those telltale marks have disappeared before we send the patient into the waiting room. And that is 3 areas of Botox in the upper third of the face. We have provided Lynn with some Botox in the upper part of the face. On the lower part of the face, she's had in the past some L-therapy, hence she has a very good jawline. She has some very small lines in the nasolabial grooves, that's nose to mouth lines. All I'm going to do here is place a small amount of dermal filler. The dermal filler will integrate with your own dermis. Okay, and you'll have an instant result. Okay, so I'm going to pop you back. Okay, so today we're going to use a dermal filler in the lower part of the face. What we do is we follow the nasolabial line. There is no anaesthetic that has been placed, and Lynn will be able to feel a small injection, and then a little bit of pressure. The main risks of a dermal filler is slight bruising following the injection, and I always remind the patient that they will be able to feel the dermal filler underneath the skin. This will normally resolve in around about 4 weeks. How do you feel, Lynn?
Fine.
Excellent. In general, people often ask, how much dermal filler should they have? In general, for a nasolabial line, we would use round about 1 mil. How do you feel, Lynn?
Fine.
Okay?
Yeah.
Okay, so I'm going to turn. Okay, Lynn. And again, what we do is we come up, we follow the line, we inject underneath, and we follow down. We follow down, and we inject as we go. And again, all I'm doing is softening and plumping out the wrinkle. How do you feel? You're fantastic. Okay, just relax for me. Okay.
Is there anything I need to do?
Absolutely nothing. Some people would suggest that they massage. What I tend to say to the patient, I'll place it in the position that it is, and we should leave it in that position. I would always like to see the patient normally 4 weeks after for a review, and dermal fillers can be used in the nasolabial, in the lips, in the chin, and really importantly in the cheek area. It's a fantastic treatment to use at really any age. It gives the patient instant gratification, and on average they would normally have to come back maybe every 6 to 9 months for a review. Okay?
Yeah.
Happy Christmas, Lynn.
Thank you.
Okay, can we sit you up?
Yeah.
Okay, have you got a mirror there? All it is soft, and she's got a fantastic face.
Oh,
yeah.
that's what I thought it was gonna.
What?
I thought it was gonna look like.
Puffy.
That's brilliant. Yeah.
Yeah. Okay, let's pop you back. Okay. So, it is evident that these treatments certainly can be done in a lunchtime. So the consent of the patient, the education of the patient is very important in any non-surgical or aesthetic medical procedure. It's essential that the patient is consulted with prior to treatment. A follow-up is always initiated, and that way we all end up with happy patients, happy practitioners, and fantastic results. Thank you from Tracey Bell.